So, today's topic is hypertension. If you are new in my channel, that is eduhub.2m, then please like, share, and subscribe the channel, and every day you will get the new contents. Today's contents, as you see here, the today's contents are: what is hypertension, causes, classification, etiology, and symptoms. So, what is hypertension? In one word, everybody we know, that is the high blood pressure is hypertension. Basically, it is a chronic medical condition where the force of blood against the artery wall is consistently too high, that is above 130 mm of Hg or higher, that is the systolic pressure, and diastolic pressure is above 80 mm Hg or higher. And we also know that thing that this is the silent killer, because normally if we think that only it is hypertension, only high blood pressure, but we don't know what are the bad effects of it. If it is uncontrolled, means we cannot control the high blood pressure, then it increases the risk of heart disease, stroke, kidney damage, and other serious conditions also. So we can just maintain through diet. Yeah, definitely medication is there, but it is very good if we can control through diet, some light exercises, this thing. So what are the causes of hypertension? This is primary, means essential hypertension. In most cases, about 90 to 95%, the exact cause is unknown. But if it gradually over many years it occurs due to a combination of genetic factors and lifestyle habits. Yeah, lifestyle habit is very important. For that reason, we are saying that nowadays stress is very much in everywhere we face, and for that reason also high blood pressure can occur. But yes, due to the genetic factors is also very important. Next is, as just now I have discussed, the dietary factors. High sodium intake from processed foods. Nowadays there is no time, so we buy the convenience food from outside, ready to eat. It contains huge amount of salt, which is not good for our health. And it also low potassium consumption, and so it increases the blood volume and arterial pressure. Lifestyle choices, lack of physical activity. It is very common because we don't get time, or we are sitting in one place for near about whole day or around 5 to 6 hours. So no exercises, and to decrease our stress, alcohol consumption is also going on. Tobacco use. This basically damage the blood vessels elasticity and contribute to weight gain. It is also another very big and very important point, that weight gain. Here also lifestyle factors are very much important, and we don't know. And this regarding this weight gain, that again that dietary factors means that processed foods, we are taking the processed food Next is underlying medical conditions, that is secondary hypertension. In a small percentage of cases, because most of the cases, near about 95%, means we can say from here that secondary hypertension occurs only 5% or 10%. And yes, it is high blood pressure here directly caused by other issues such as certain chronic kidney disease, thyroid disorders, or sleep apnea. And some second reason is some medication and substances, certain drugs, including birth control pills, then some NSAIDs we are using very much nowadays, and means the painkiller, and as well as illicit substances like cocaine. It can trigger basically the hypertension. Next, if we think about the classification of hypertension. So, first is normal blood pressure. Everybody we know that is 120 by 80 mmHg. That is normal blood pressure. Then is elevated blood pressure. That is systolic is near about 120 to 190 mmHg and diastolic less than 80 mmHg. Then stage 1 hypertension, that is systolic 130 to 139 mmHg or diastolic 80 to 89 mmHg. At this stage, doctors typically recommended lifestyle changes. Every time we are seeing that, we are basically emphasize on that point that lifestyle changes. And if here as a student of nutrition, we have to be think about the lifestyle changes as well as the dietary changes. Next is stage 2 hypertension, that is systolic pressure is 140 mmHg or higher than that, or diastolic pressure is 90 mmHg or higher, and it requires prompt medical evaluation where the doctors prescribes the medicines, and definitely with this medication lifestyle changes is also necessary. And then that is very emergency condition, that is hypertensive crisis, systolic over 180 mmHg and diastolic pressure above 120 mmHg. This is a medical emergency requiring immediate hospital care, because on that time it's not possible to give the treatment at home condition, because some other symptoms also arises, that is chest pain, shortness of breath, vision changes, means blurred vision can occur. Next is etiology of hypertension. So it is broadly divided into two categories. One is primary, that is essential, and secondary hypertension. Primary hypertension, which accounts for approximately 90 to 95% of these cases, has a multifactorial etiology involving genetic predisposition, environmental factors, lifestyle choices such as high sodium intake, obesity, physical inactivity. And secondary hypertension, comprising the remaining 5 to 10%, has an identifiable underlying causes including renal artery stenosis, chronic kidney disease, then primary aldosteronism, obstructive sleep apnea, etc. And other reasons are also there, like certain medications like oral contraceptives, NSAIDs. Already I have discussed regarding that, and decongestants as well as illicit substances like cocaine. It can increase the blood pressure. Ultimately, the pathophysiology involves complex interactions between increased systemic vascular resistance, heightened sympathetic nervous system activity, and dysregulation of the renin, angiotensin, aldosterone system, all of which contribute to sustained elevation in arterial pressure. Next, these are the symptoms of hypertension. First is, as I discussed, that this is a silent killer. Means you cannot understand the symptoms when you see. Then also sometimes you cannot understand that what is the thing basically going on. So it is often asymptomatic. There is no symptoms. Hypertension typically does not produce any warning signs. It cannot knock you, and you cannot detect basically. So for that reason, it is also known as silent killer. Next is severe headache. Headache is very common, but when symptoms do appear persistent, uh, throbbing headaches, especially in the back of the head, and are one of the most common complaints during episodes of markedly elevated blood pressure. Means whose blood pressure increases and they don't know previously, but with this pain at the back of the head, so it is a very common complaint, and with this they can understand that maybe pressure increase. Third is dizziness and blurred vision. Patient may experience lightheadedness, dizziness, or visual disturbances such as blurred or double vision due to effect of high pressure. But sometimes if it occurs very means on and off, then definitely there is hyper means the patient is hypertensive. But sometimes we think that maybe that is the problem of our eye power. And other general signs are like shortness of breath, chest palpitations, fatigue, confusion, even nausea or vomiting also. And hypertensive crisis symptoms are in a hypertensive emergency, that is when the systolic pressure above 180 mmHg and diastolic pressure is above 120 mmHg. That is the severe symptoms like intense chest pain, severe anxiety, shortness of breath, means totally different. Seizures or loss of consciousness. So in that time, it's needed immediate emergency medical attention. So thank you, and please wait for next content.